Hello and welcome to my pre-hospital emergency care videos. My name's Jason Sadler and I am a paramedic with the HCPC here in the UK. As a disclaimer, all of my videos are from my own education and from my own qualifications and the experience I've learned in the pre-hospital environment. Currently, I work as a lecturer in Swansea University. I also do work on the bank for the Welsh Ambulance Service, NHS Trust, as well as working for small independent companies. All of the information I'm giving is solely to do with myself and not connected in with any of those companies. Please can I emphasise, it is really important that you get yourself booked onto a registered, recognised qualification and you only work within your scope of practice. We really hope you do enjoy these videos. Please subscribe, please like, and if you would like any other videos, please send us a comment. Hello and welcome to this video on manual inline stabilization, something that we commonly come across in the pre-hospital environment. Now, because we're on to this stage, we've already gone through our scene assessment, safety cause, environment numbers, extra resources, and as we were doing the cause and we looked at the mechanism, we had reason to believe that this person may have a spinal injury. If we're going to immobilise the spine, we should immobilise the whole spine, not just one section of it. So what we're going to go through in this video is the manual inline stabilisation, but the next video we will look at how we can use equipment to help hold that stabilisation in place. So first of all, looking at my mannequin here from a side-on view, as we can see, the mannequin is very clearly not in neutral alignment at this time. We can always afford to bring our patient back into neutral alignment with our manual inline stabilisation. Working from behind the patient, I could just hold on to the head, being careful not to block the ears, and I can bring the head up until I achieve neutral alignment. As you can see from where my hands are now, it's okay to do, but it's not brilliant. What would be better is if I brought my forearms down and rested on the actual patient and then supported the head. I can now get a nice clamp on that in neutral alignment, and I might need a colleague who's looking at from the side to tell me once I'm in neutral alignment, and I can just stay there. The important thing about manual inline stabilisation, once I take it on, I don't let it go. So I maintain this throughout. If I was to work from the side of the patient, I could then clamp, and using my forearm down their breastbone, I could clamp onto the face, but that may block the mouth, so I can clamp onto the mandible, but then it does limit what their talking ability and potentially their airway. And the other hand can come down their spine, hold onto their occiput, and as you can see, I do end up very close in to the patient, but I can get a good grip on there. Very often, this kind of technique is used in water environments by some of the rescue organisations. So just clamping on and holding in place. If our patient is in a laid down position, and I've just got a comparison here that you can see, again, I can come in from behind, but what we've got to appreciate is laying down with our head flat on the floor is not a natural position, particularly as we get older and we get curvature of the spine. And what we may have to look at doing is raising the head up about 2 centimetres off the ground, and you may have a blanket that you can use which will help you to achieve that. So by raising the head up and supporting it on something like a blanket, this would be more like a neutral alignment from a side-on view for the patient. For me to clamp onto that, I'm just going to rotate around so you can see. Again, I could use just my hands and I can clamp on to the patient try not to block the ears, and once I've got it, I can't let go. But this does allow, if the patient moves or I move, lots of problems. I am in a good position, ready to do the jaw thrust if I need to, but if you want to get good manual inline stabilization, if I actually support on the body, so for example down onto their shoulders, I can then use my forearms to clamp the head, and this will achieve a much better stabilization position. But what this doesn't allow is for the next piece of equipment to be put on, so we would have to change it at that stage. Just to show you here on the skeleton version, as you saw, I can clamp on. I am in a good position for doing airway manoeuvres if needed, but it does allow for a range of movement in the cervical spine here, which is what we want to avoid. So by clamping on, maybe down on the shoulder blades, and I may want to take a better position where I'm laid down and I can support support the head between my arms, and now I can actually brace and I can maintain this inline stabilization for a much longer period of time. To ensure I've got manual inline stabilization while I'm holding it here, I can continuously communicate and talk with the patient, making sure that their nose, chin, breastbone and groin are all in one line, which I then know their spine will be in that alignment. So that's the end of that video. Please don't forget to hit the like button, and if you want to subscribe, you can keep up to date with our new videos. Until then, stay safe and goodbye.